Hi you guys, it's Dr. BT and I kind of want to go over with you how to do your health history. If you follow these instructions, you should get a really good grade. It is a little time consuming. However, it does teach you how to do a good health history. So you're going to do your health history on Tina Jones. Tina Jones, you have an assignment that says Tina Jones in your, for your shadow health. And so you will be able to ask her all these questions and gain this information on this health history. Remember, health history is super important. It can lead us to all types of problems and diagnoses, which we need. So the false name that you're going to use for your patient is TJ, Tina Jones. And I'll be able to see where you ask Tina Jones all of this information in your shadow health document. So you'll use this form. And it's kind of all filled out for you. You just put your name right here. And then underneath here, you put Dr. Julie Baker Townsend because I'm your professor. Okay, so now we're going to come and we're going to ask Tina these questions. Her name is TJ. You're going to put the date of the exam. You're going to ask her date of birth, her age, her race, her gender, if she's a military veteran. Then you're going to say, what brings you here today, Tina? What brings you here today? And whatever her response is for what brings you here today, you're going to type it in quotations right here. So let's say she says, because I hurt my foot. So it would be because I hurt my foot. So then here, you're going to do a symptom analysis, which is onset, or when did it start? P, palliative, what makes it better? Precipitating, what makes it worse? And you're going to put the information here, right? Q, quality. So, sorry. So Q is quality. What is the pain like? Is it sharp, shooting, dull, aching? R, does it radiate? S, severity. That would be like a pain scale. And let's say it was a lesion that was, had exudate. You could say, how often do you change your dressing? Like, is it continuing to ooze or whatever? And then, so severity is S. And then T is timing. Is it only when she walks? Or is it all day? Is it all night? What's going on? So now we're going to put her allergies. So this is drug, food, topical, inhalants, like pollen. Okay. Are seasonal. So you're going to ask her all of that. So now you're going to get her past or her family history. So did your mom and dad have stroke or hypertension? If they did, you put an X here under family and you put who it was. Did they die of it or was it controlled? And then you're going to ask her if she has had it. And so if she has had it in the past, you're going to put an X. If it's negative, let's say that she has not had a stroke or hypertension and no one in her family has, you put an O here for past and O for family, and there's no comments needed. But if there is an X anywhere on here, you need to talk about the patient, and the family here. So a genogram is just taking this information, and you can look it up online. It's in your Jarvis textbook or any type of health assessment textbook, and you make a detailed diagram of it. And it's just, just like 23andMe or any of the genogram information. It's just like a family tree, and then it shows their disease. If you attach it, I will give you a bonus. If you do not, I will not take off. So nutrition, you want to do a 24-hour dietary recall. Like, would you eat in the last 24-hour? Exercise, how much she exercises a week, and what is the quality of that? Is it aerobic? Is it non-aerobic? Is it weightlifting? With the number of minutes. So on current medications, you're going to put the type of med, the name of the med, the dose, the timing, and so let's say that it's, Tylenol. Acetaminophen, 325 milligrams, twice a day, and she takes it every day, or she takes it PRN. Now, if it's an everyday prescribed dose, ask her if she takes it all the time, and let us know. So put that for all the meds. And then these are just checkpoints. So does she use her seatbelt always? Ask her. Do you use your seatbelt every time you get into the car? Or do you use it sometimes? Or do you not use it? And then you mark. Of course, we want to ask her about tobacco. Tobacco, yes or no. The type, is it vaping? Is it cigars? Is it cigarettes? What type is it? How much does she do it? And then if she stopped, how long did she smoke or vape or whatever? And when did she stop? Alcohol, the same. The type here is important. A mixed drink is very different than drinking a bottle of alcohol a week. One mixed drink, let's say every 3 months, is very different. So you really need to say what type it is. Is it grain alcohol? Is it a wine cooler? I'm dating myself. Is it a wine cooler? Because it has very little alcohol versus grain alcohol is a high content. How often or how much, and did she stop? Same thing with drugs. You want to hit cocaine, methamphetamine, alt crack, any of the street drugs, and you want to ask about those. Okay, so now moving on to review of systems. So review of systems is the most challenging part of this entire process. So a lot of the things you don't really, this is a new introductory thing for you. So I want to show you that you're going to use an additional supplement for this. So if you look on there on the assignment, it says that there's a health history supplement. So if you look here, it has general, integument, skin, hair, nails, head and neck, ears, eyes, all of the things that you're going to do your health assessment on. So from the very beginning, you need to get a good review of systems, because you're going to not only use this for the health history, but you're going to also use this every system that you do. So let's do integument. So we're going to copy integument here. And let's go back to the review of systems. So like you can see, skin, hair, and nails. If I paste this in, you can see that this is very different. So we ask her, do you have dryness? Do you have all these things? But if you ask these additional questions, I pasted it in, which probably I should not have done. But let's say skin, hair, and nails. I want you to do this. Like, ask her these questions. So let's do one that she says she has a ulcer on her foot. So she's going to tell you she has a skin ulcer on her foot, potentially. And so you would do O, P, Q, Q, oops, Q, R, S, T. So you're going to do, when was the onset of this foot ulcer? What makes this foot ulcer better, or what makes it worse? what is the quality of this foot ulcer? Is it open wound? Is it a scab? What is it? Does it radiate? Does the skin ulcer pain radiate? What is the severity of the ulcer pain? And then the timing. So you're going to ask that for all of these. And if you get one with an X, you have to do the OPQRST on any of that. I also want you to go to this document and ask her all of these questions. And you're going to turn this in with it as well. So, what is your usual skincare? Do you take baths? Do you take showers? Do you have sun exposure? Do you go to a tanning salon? You're going to ask all of these questions to her. So, going back, just to make sure you guys understand, you're going to ask all of these questions. And if you get a positive, you're going to do OPQRST on any positive. Then you're going to go to your supplement. And you're going to ask her these questions as well, because this will guide you through the whole course of the semester, because you will have this information already done. And when you go to do your health assessment, you kind of know her history and review of symptoms for everything. Okay, so you're going to ask her all these questions. Some are included in this form and some are not. So I want to be very clear yet again. You're going to do these. You're going to do every single system. And then you're also going to ask these questions right here for every single system. Some are going to overlap. So you'll see like chest pain. Do you have chest pain? Well, that's on this form too. So you can see chest pain. So you only have to ask the question once, but this document is much more detailed, the supplemental review of questions, and you're going to need all this information. So you're going to turn in 2 documents. This one with all the information, you'll check it and you'll check the information, and your health history form. Okay, so I think that's kind of the hardest part of this, is getting the whole health history. Down here on genitourinary last menstrual period, you need to put it here. Or does she not have periods anymore? You need to put an explanation. Gravida, how many times has she been pregnant? Full-term babies, how many babies have gone past 37 weeks that she delivered? How many preterm babies from 20 weeks to 36 weeks and 6 days? Abortions, how many abortions and how many living children does she have right this minute? And then lastly, this little part is the last examination. So you say to her, Tina, when was your last physical exam? And whatever she says, you put here. You may have to ask her in a different way, like when was the last time you went to the doctor? When was the last, because she speaks the way a regular patient would speak. So if she tells you, I've never had an eye exam, you write that right here. You type it in, I've never had an eye exam. When was your last TB or chest x-ray? I don't know. I don't know if I've ever had one. You write that in. And then once you do all of that, you guys, you're going to send me this document, and then, of course, the review of systems document, this one, that has all the information filled out, and you'll be good to go. So if you have any questions, please email me, and I'm happy to answer anything for you. Thank you.